Morning. Thank you everyone for joining. I'm Lacey Fehrenbach, Deputy Secretary for COVID-19 Response. I'm going to share high-level disease trends with you. We are seeing some signs of improvement, but disease remains high across the state. We're encouraged that we're going the right direction, but we have a long way to go to get through this Delta wave and prepare for the winter respiratory virus season. Based on data reported to our disease reporting system, cases are decreasing statewide and across all age groups. This includes school-age children. As of October 3rd, the 7-day rolling average is 2,558 cases, and that correlates to a 7-day case rate of about 234 cases per 100,000. So still quite high. You can see on the graph similar to early January. Our hospitalizations are also decreasing for a few weeks now. Our 7-day rolling average is 122 new hospitalizations, so that is quite high. Our current 7-day rate is about 11 per 100,000. So that's, you can see there on the graph, a little higher, getting close to where we were at the peak of our winter surge. So more work to be done. When we look at our WaHealth data, COVID-19 hospital occupancy is at 18%. This is a decrease from the high of about 25% in early September, but still well above our goal of being less than 10%. Total occupancy remains high at about 91%, and ICU occupancy is sitting around 88-89% from day to day. COVID-19 ICU occupancy is at 29%. That's a decrease from our high of 37%. A move again in the right direction, but still above our goal of being less than 20%. I want to remind folks, we continue to see that the majority of people hospitalized with COVID-19 are people who are not vaccinated, and the vaccine offers extraordinary protection against severe disease. Unvaccinated people who are 12 to 64 are 19 times more likely to be hospitalized with COVID-19 compared to those who are fully vaccinated. And for people 65 and older, you are 9 times more likely to be hospitalized for COVID if you are not fully vaccinated compared to those who are. Taken together, the healthcare system is getting a little bit of relief, but is still very, very stressed and stretched. And we expect that this will continue because disease is high. There have been delays in care, and we have other respiratory viruses coming our way as the fall, winter months approach and gatherings begin happening. So our ability to continue on this trajectory really depends on the public continuing to step forward to get vaccinated and wear their masks. These are positive signs. We want to recognize that progress, but we've got to keep rowing together to protect our communities and our healthcare system, as well as our families. So I do want to talk about holidays because they are coming up for many of us. And my first and most important message is that if you're going to gather for any reason, please get vaccinated, both for flu and for COVID-19 if you have not yet. It is hard to believe, but Thanksgiving is 6 weeks away from tomorrow. So if you are not yet protected and have not yet received your COVID-19 vaccine, you have time to get that full protection before that holiday. You'll be protecting yourself and others with whom you may gather. So please call 1-833-VAX-HELP. Talk to your healthcare provider, get your questions answered, and get your family protected. Whatever the gathering, please wear your masks when you are indoors with people from outside your household or in crowded outdoor settings. Wash or sanitize your hands or the hands of your little ones often. That's important for all of our respiratory viruses. And outdoor activities and gatherings are safer than indoor ones. You can take your kids trick-or-treating around the neighborhood. We would recommend limiting indoor Halloween activities, especially if you have kids that are not yet eligible for vaccination. Whether it is a holiday or a football watch party or something else, try to gather with your family and friends outside. And if you do gather indoors, make sure you have good ventilation. Turn up your air system. You can even open a window, that helps. In either case, you can consider having your guests take an at-home test before the gathering just to make sure everyone is as safe as possible. And importantly, stay home if you're sick, have any symptoms of COVID-19, or were recently exposed to someone with COVID-19. Working together, we can stay on this hopeful path, can keep ourselves and our loved ones as healthy as possible during these fall and winter months, and ensure that our healthcare system can continue to meet the critical needs of all Washingtonians who need care. And importantly, as Dr. Bell mentioned, keep our students as safe as possible in their classrooms and there in person for learning.